Good afternoon. I'm going to let a little bit of time go before we launch because the participants are entering the session right now. But just a quick little brief introduction of myself. I'm Gigi Davis. I'm the Job and Internship Coordinator at Piedmont, Virginia Community College. It was great that to be able to get Pam to be a part of our event because I first met Pam, gosh, I would say when I was doing the Elevate program, and I learned so much when I went to that information session. I was like, oh, so when we decided to put together this career chat series of conversations with employers and alumni faculty, that Pam immediately came to mind, and that I am sure that she will educate you all just as much as I got educated way back then, many years ago. And of course, she is senior recruiter with UVA Health Center, Medical Center. And I'm going to let her launch it off and tell us a little bit about your career journey and, what you like about what you do, maybe what you don't like about what you do.
Oh, come on now. I love it all. No, thank you, Gigi. First, I want to thank you for giving me this opportunity because I enjoy working with the community. We start with our community because we live in our community. My name is Pam Thomas. I am one of the recruiters for the University of Virginia Health System, or as you all know now, UVA Health. I have been in the medical center for 35 years. I've done many, many positions, administrative. I have done working in HR for over 20 years. I also was a pharmacy technician, I always did dual roles because I wanted to do patient care as well. So being part of the recruitment team, I have recruited for every type of discipline in the medical center. For example, labs, radiology, entry level, technical, anything technical or professional. I feel like, I like to help individuals if they have questions or they're wanting to say, how do I start in a career? 35 years ago, did I think I was still going to be here? But anyway, you'll find out that if you start a career at UVA, there's lots of tentacles, lots of networking, and lots of other positions that you can go into, and careers that you never even thought of. For example, labs, histology tech, clinical lab scientist, techs, nursing, transporters, greeters. So when you think if you're a patient in the hospital, all you think about is doctors, nurses. Okay. So who transports you to the OR? Who sets you up in the OR? Could be a nurse. It could be a surgical technologist. Who does all your specimens when you have any kind of lab work? Specimen management technicians. So I want you to think outside the box today. I want you to think of careers that, I sometimes talk to candidates that say, oh, well, I had a family member, that worked at UVA, and this is what I said, well, what did they do? They're like, well, I don't really know. So today I would like to engage the conversation in where you feel that maybe there's an avenue you had not investigated. Are there certain courses that you had not thought about? I guess it's just, conversation, and please, no question is stupid. Anything, any interaction that we have, I'm here to assist and engage in our community members and our PVCC students. So I'm here for whatever you would like to discuss.
Great, thanks. And that made me realize that I forgot to tell people, make sure you put your questions in the chat.
Okay.
And so it's not just me asking the questions. So we really do ask folks who are participating to feel free to put your question in the chat box. You can make yourself anonymous. but that's where, and we won't be mentioning names since we are recording this. So anyway, so my question actually, because that was a beautiful introduction, is that I constantly try to tell students, hey, you can get a job at UVA before you finished your program of study. And so
Yes.
you alluded to some of the entry level positions and so, where patient transporter, companion, et cetera, essential services tech, because a lot of
Yeah.
students are like, what's that? And so can you describe a little bit and how many positions are part-time versus full-time? Because that does somewhat impact. And of course, for the nurses who are actually in our nursing program, how I'm pretty sure they can get a CNA job without having a CNA license. So if you can talk about that, that would be
Yeah,
fantastic.
sure. Thanks, Gigi. Basically, if you are currently enrolled in a nursing program, I believe at PVCC second semester, you have completed your assessment program, your assessment class, or used to be called Med-Surg Fundamentals. And you can interview for a CNA, a certified nurse assistant, if you have completed the Med-Surg Fundamental. Now, in addition, if you're like a second semester and you've done your first Med-Surg clinical, then you can come in and interview for a patient care technician. Now, that being said, let's go into the different calibers or the relationship between a wage, part-time and full-time. Okay, wage in nursing terms, PRN as needed. You do have to do 72 hours in a 6-week schedule, which is not bad. You could do a 12-hour Saturday or whatever. Opportunities would be working in the float pool. Float pool, you could work in all units, learn the different kinds of patient populations that we deal with. Now, the cost of living wage rates were a little different for wage versus benefited. So a nursing student or anyone coming into the medical center in a wage status would be getting rate at $13 an hour. Okay. Now, that is just because it's non-benefited. Now, other than that, the other disseminations are part-time benefited, full-time benefited. Be a 20-hour benefited employee, partial benefits. In addition, your rate would be 15, starting rate 15. If you are full-time benefited, it starts at 15 with full benefits and your premiums are a little lower. So that's a little bit. Now, most nursing students come in as, and I'm going to be honest with you, not just nursing students, all of PVCC students. I had this the other week, for example, 2 students were taking prereqs for nursing. So they may have a virtual class on Monday, Wednesday. Okay. So then I said, well, what about an evening shift, 3 to 11:30? And this is going to pertain to everyone who is attending today. I know it's just not nursing. For example, I have health unit coordinators. They are the old ward clerks. What they do is they run the nurses station. They do all the paperwork, print off medication orders for nurses. They call transportation. Because recently I've had people, I've had individuals say, I just want to get in the healthcare environment. Transporters, transporting the patients by a bed stretcher wheelchair, greeters at the information desk. At the information desk, screening for COVID, hand sanitizing, taking their temperature, masks, specimen management techs, that's entry level in the labs. There's just an abundance that people don't realize is out there. And actually, and the biggest thing that I hear from candidates, you've got so many job titles, I don't know what they are. Okay. So always read the job description as well. Mm-hmm.
That's where when central services tech came up and people would be like, and we actually started a program in that a while ago. And the people were like, oh, you can get a job cleaning surgical equipment. And a lot of times they said that was probably one of the better positions for people who had recently immigrated to the United States and whose language skills are still in development stage, because you're focusing on a hands-on skill more so than a patient interactional position. Because as I've heard you say before, English language skills are critical when dealing with the patient.
That is, yeah. And then thank you, Judy, because the sterile processing technicians, I actually recruited for that, and I actually went down and shadowed with them for a little while, because you recruit for something you don't know. So what they do is they have stations and they provide kits. For example, you have a patient who may go to the operating room, is going to get a total hip or total knee, and the instruments are lined up for that physician to pull them. So when you make trays for OR, you all the instruments, anything that is used in the patient, in the clinics, anywhere. It was very interesting watching it. They had magnifying glasses, making sure that, everything was clean. It was really cool. I was really surprised. So that is another type of position that is out there. And also surgical supply. It's in the OR. They're the ones that make sure that rooms are prepared and the instruments are in there prior to the OR, to the procedure. They make sure stocking is there. They may go up to the units and pick up the patient. So there's just an abundance of different positions. Yes.
Yeah, and that's actually it was we already have some questions coming in, so I'm impressed with our folks who are participating. One has asked about, what does UVA have for folks taking the community health worker program at PVCC? And of course, I don't know if you've heard about that through Ridge Schuyler. It's where, from my understanding of it, because it is a more of a network to work.
Okay, I work with them. Yeah.
And so that's where, from my understanding, it's really any of the entry level positions.
Yeah.
Having an interest and desire to be in the healthcare setting is critical, right?
Correct.
Anything that deals with, you need to have a passion for dealing with people. If it's coordinator or patient access associate, it's also good to be good with computers, or good with medical terminology, or good with being detail oriented, especially if it involves insurance and that kind of thing. So, if you could talk about some of the, because that's where, what do you look for from candidates for, whether it's nursing or these other positions? Because I didn't want to over gloss on that. but
No. And I hear what you're saying. So, okay. So as a recruiter, and so let me start by saying I am a recruiter. I am the candidate's recruiter and also the recruiter for the manager. I feel that relationship that I build for both of them is very important. Okay, what I look for is, and I'm going to be very transparent with everybody, because I am an honest recruiter. I don't do something that's not true. Never have, never will. And I pride myself on that. Sorry. But anyway, if you were to apply, let's say for any job, and myself as a recruiter would view your resume. Now, if I see that you've worked 6 jobs for 3 months at a time, I'm going to get a red flag. But if I had a conversation with you and you had circumstances beyond your control, like it closed down, I moved from another state, but that is something that a lot of people don't put on their resume or their application. So manager would say, oh, wow, boy, what a job hopper. But if you were to put on your resume or your application, organization, closed. And with COVID, we have such different circumstances, okay? And if I was to put you in front of that manager and screened you about a specific interest that you had, and be able to actually relay that to the hiring manager, you would have much much more success to get an interview. Okay. Another thing that we look for as far as screening is, and I have managers tell me this all the time, I don't interview someone who doesn't have a resume. Well, back years ago, most people didn't have resumes. And, I try to encourage everyone to submit a resume, even if it's a basic, not, you might not have anybody to guide you. Go online, you can get a sample resume and just put your dates and your information and your positions that you have. I have taught my managers that if you have an entry-level person, they may not have a resume, and you do not reject them just because of that, because they could have a stellar work history in that application. So attention to detail, like Gigi said, never, ever leave an application blank. For example, make sure you answer all your legal questions. Make sure I will tell you something that I get a lot. I don't remember the dates that I worked there. Well, we do background checks and we do reference checks. And, I've had people who were totally off by like 2 or 3 years. And then, as an employer, we have to be very cautious to make sure that things are correct. So making sure your application and or your resume have the dates as close as you possibly can make it. Okay.
Yep, it's amazing. At Wegmans, they are particular about that they say if you don't hit your dates just right, there you don't go farther in your application process. So that's a really a great point. I've actually have another question. That it was that she's put in several applications for UVA, PCT positions at UVA during her time at PVCC's nursing, but never heard back about them. Now in her last semester, she's applied for UVA's nurse residency program, but still hasn't heard back. And which I've that's where I know the piles and piles of candidates that you get. And that is actually one of my questions is like, how many candidates do you get per position? But can you give any advice on how to get their application noticed? And I think that ties into one of my questions to you is how does a candidate set themselves apart from the other piles of people?
Mm-hmm. Well, first off, I will apologize, and I don't know who you are, but I will also, what I see a lot is that individuals apply for the wrong positions. And instead of reaching out to you, you're probably going to be rejected because you're in the wrong pile. But as far as the nurse residency program, Gigi, if you could get me that name, I will give it to the appropriate recruiter.
Yeah, I'll make sure she gets me permission, but I'm pretty sure.
Okay, no, that's fine. I just wrote it down. Okay. How do you get noticed? Okay. Well, I want to be honest with you. You got to be very persistent. Because I'm not gonna lie. I have people who call me every week, or I don't mind people being persistent, because to me that says you really want a job. Okay. I want to go over something with everyone that you probably don't know. When we have positions, for example, an access associate, here, let me give you an example. Access associate, we are a federal contractor, even though, UVA, we're separate from the state, but we're still granted by the state grievance process. So, for a perfect example is I didn't get seen. I've applied 25 times, I'm frustrated, and never get a call from a recruiter. Okay, so when you have, for example, an access associate, we as recruiters are required to send the candidates that meet the qualifications to the hiring manager as you have applied. So, perfect example. I tell my candidates, and this is going to be your homework. You're very interested in the job. You're gonna have to stay online and look every day. Okay. The sooner you apply, the sooner, if you meet the qualifications, you'll be sent over to a hiring manager. So I've talked to candidates and I say, well, I'm sorry, but there's 49 candidates ahead of you. And as a hiring manager, if you have 49 qualified candidates, you're bound to find somebody out of that 49 to hire. So you have to do your due diligence. I will give you a couple tips. Right now, I would say the percentage of postings that go up Friday afternoon, Friday evening, or at this point, Monday morning, because because of financial mitigation, every position is scrutinized every Friday by leadership. And the recruiters get a list of approved positions. And for example, for me, I know I write down every position that was approved. And so your best bet is Friday, Saturday, Sunday, Monday. Get out there and apply as soon as you can. And so that's just a little word of advice, how our processes are working. Now, that being said, you know, if I have an opening and by regulation, posted for 5 days. It used to be 5 working days, but now it's just 5 days. Now, I might keep that open for 7 or 8 days. And just think about this. I will have 150 candidates on there. So what makes you stand out? I'll be honest with you. You know, I've had cover letters before. You know, when you do a cover letter, I will give you one word of caution. You change the title every time you apply for a different job. Because I see a big mistake is they use one cover letter for every job they applied for. And the manager's like, well, this isn't a program coordinator. This is an access associate. So that's one word of advice.
Or they mentioned the other competitor in the name.
True. Resumes, like, you know, like I previously spoke, you know, resumes are a foundation. And, you know, even though, you know, I've been in this role for so long, I keep an active resume because sometimes you want to add accolades that you've gotten, any kind of awards you've gotten, any other courses you've attended, any certifications. And being detailed in, okay, this is something, sorry, Gigi, I can talk forever. This is something that I really want to speak out to the participants about. I really get frustrated when someone says, well, I only was a cashier, or I only worked in a call center. I want you to you can write this down prior to applying. What do you mean I was only a cashier? You probably worked with customer service. You worked with money. You worked with credit cards. You opened applications for credit cards. You had to work with team members. You had to stock, probably clean. You had to straighten. You know, you dealt with the public. You took incoming calls in that department. So really strategically think about the duties of a position. I tell that to people every day when they say, oh, I'm just a CNA. I say, oh, no, do not ever say that to me, because everyone brings something to the table.
And that's so beautifully articulated, because that's when you said, well, we can pass along people who are qualified, but if a candidate doesn't stipulate or highlight their qualifications, that kind of puts you in a bind. And that's actually both Andre Luck, PVCC's career service manager.
Yep.
We give feedback on resumes and cover letters, because I see that the cover letter can set you apart from so many other people if written well, and targeted toward that individual position and or institution, because that's where I was referring. A lot of people say, oh, I accidentally submitted a letter I sent to Martha.
Okay.
And no,
Yeah.
that's not good. So that's where, you know, there is lots of community support for developing your resume at Virginia Career Works.
Yeah.
Town Job Center in the bottom half of the library, as well as out at Albemarle County Job Center. So just know there's tons of support in town to help make your resume zing. So anyway, so that's beautiful about the resume and cover letter. Is there other things that they can do, like volunteering or being on LinkedIn, which is kind of an online resume, or net? Because I do agree that your point about persistence is huge, but I would also add persistence without being a pest. So like if somebody like emailed you every other day, or, you know, that tends to make them not as strong as a candidate, I would think.
Well, no, I would disagree, Gigi, sorry. But mind the persistence. I don't mind you bugging me. I'm the recruiter, but don't go to the manager every other day. So, well, you had an interview, maybe they gave you the business card, or over Zoom, you got their name and contact information. I am the middleman, and I am the one that is supposed to work between the candidate and the manager. Now, I have to go back to that manager. Say, are you going to offer them a position, or are you not? I need to forward them to other areas. I guess, I get feedback from interviews. Well, let me go back to the other piece you just asked. Yes. You need to build a foundation on LinkedIn, because, when I go in, I sporadically go in, you need to build your contact base. So when you go in, there's tons of people you can add as a, add. It could be a friend, it could be a past teacher, it could be a pastor, it could be anything. But get out there and start utilizing your social media. I'm not talking about Facebook. I'm talking about LinkedIn. I think that being on LinkedIn, for example, when I recruited for labs, I was in the, Blood Bank Association. I was in different organizations. So basically, I don't know, but, sometimes people do put recruitment events out there. Sometimes people put in looking for a specific person. So it's just LinkedIn is out there now to build your professional portfolio. Just get your name out there. Be with, individuals. Mm-hmm.
So, but you did mention Facebook. Do you guys check their social media presence to see how they are coming off? Because that's where I've had some employers go, if they're negative on Facebook, or I've had employers say, I saw some stuff on Facebook, even though, they didn't realize I had a connection of a connection. Do you guys go to that level of checking?
No, we shouldn't. Basically, there is a social media policy at the medical center. We don't check Facebook. I did have one manager that did. She left. I didn't feel like it was appropriate sometimes, because what I do professionally and personally is my business. But I would caution anyone. I haven't heard of anybody else checking that recently, but I'll tell you a story. You have to watch what you put on Facebook if you work at a large facility, because everybody's looking at it. And you don't know who your friends are and who to share it with. So I want to give you an example of an employee who called in sick and took pictures at the zoo. So everybody in the department went back to the manager and showed them. So you have to be careful about what you do and what you say.
Yes.
Media is out there. Keep your personal and your professional life separate. We allow phones at the medical center because of emergencies, but don't go hiding in the bathrooms and get on your phone for 45 minutes.
That's a great point. And I have seen people busted on that. Oh yeah, I'm sick today. but actually,
right.
What about thank you letters after they've been interviewed? Do you guys Does that make a difference in the hiring process? You know, if
I would
they,
say yes.
okay.
And if you want to ask me, I'm going to tell you, I barely get that ever. Nope. I never get any candidate emailing me asking me for the manager's email address.
Wow,
Nope. Nope. Very rare. Very rare.
that's all. Wow, that's, see, you're constantly teaching me things. Thank you, Pam.
Well, here's another thing. Think about it this way. For example, if you interviewed for a position and you didn't get it, and I have myself didn't get the job, but I still sent them a thank you note for giving me the opportunity to interview. And, you know, I look forward to possibly in the future, if you have another opening, because then if you don't do that, you're going to shut your bridge down. So, you know, they might think, wow, he or she was really, that was really nice. And they could have been here's the thing. They could have been the second in line for an offer. So just send them a quick email, you know, thank you for the opportunity, you know, and I have said to them, you know, good luck on your endeavors. I hope you find a great person to be a part of your team. You know, never burn your bridge, and could have been that second person who was going to be offered.
Yeah, no, I think that's a really amazing point.
Mhm.
We have another question.
Okay.
So, and I think it's beautifully written question. So depending on how you craft your resume with your qualifications, about being a cashier, can you still apply for healthcare jobs?
Oh my gosh. What? No, of course you can. Okay. So let's go back. And it was an awesome question. Thank you. Any job at the hospital is highly visible, highly customer service orientated. I cannot teach you customer service. I can teach you a skill. You got to be that compassion. For example, I'll give you a couple examples. An access associate works in all the clinics registering patients prior to appointments. Okay. So if you were a cashier, access associates register patients, take co-payments. Compassion to me is you're registering a cancer patient who has got, I don't know what stage of cancer they may have, just a smiling face and being nice and offering them, would you like to sit over here, or, So yeah, that was exactly what I was previously talking about. Entry-level positions look for customer service. Now, that being said, candidates have got to be specific on your interview questions. Okay. So what I get sometimes is they really didn't answer the question. So for example, tell me a time you had a conflict. Oh, I've never had a conflict. Okay, you've had a conflict in your life. I mean, it could be your mother, your father, a teacher, a sibling. They don't care what the situation was, but, it was a situation. So, don't give hypothetical answers. I had a manager come to me and say the other day, she wasn't direct on her answers. And here, okay, I'm going to bleed this into something else. She didn't act engaged. Didn't act like she wanted the job. I'm going to be very truthful with everyone with with Zoom, all these new virtual interviews that we do. Professional is have the correct attire. Don't be in the house with the kids screaming across the back floor, because I know you can go to a library, you can get in your car, you can go somewhere. I had one manager say the kids were screaming so loud I couldn't even hear the answers. If you are truly interested in a position, you will make an arrangement to do a very good interview. Because with social media, we are taking a chance now on hiring people virtually. Okay. You don't get to come in the hospital and interview. You don't get to shadow and see what the position is like. We're taking a chance on you, but you're taking a chance on us. Because you sort of know what the role is, but you really don't know.
Right.
So COVID has caused challenges in the work relationship and interview process.
That's so integral. That's actually one of my job search tips for folks is that if you're getting interviews, your resume's going in the right direction. But if you're not getting a job from the interview, there's something going wrong in the interview process. And that's actually also Andre Luck and I are here to support and do mock interviews. And we'll actually be doing a big event as part of the Tom conference, career conference, that we're featuring healthcare careers, so that you will actually be able to sign up for a mock interview or a resume critique with an employer at that event on April 2nd. So it'll be totally free for you to get that kind of support. But of course, again, Virginia Career Works, Downtown Center, there is lots of wonderful support to help people develop these the skills, either resume writing or interviewing, cover letter writing, etc. So that's great. Now to get somebody's foot in the door, because that's where I've promoted UVA's volunteering program a lot. Does that help somebody's candidacy in the when you're previewing? Because that's where you also, a volunteer program is amazing. I think it's 100 hours that you would volunteer, but then that way you're actually on different units and meeting people and getting a great experience for your resume. Would you agree?
I do agree. And for example, nursing or any healthcare field, they want to see if you've been in a hospital environment. And as you said, our volunteers, they might work in discharge and help get a patient to their car. They used to deliver, sympathy cards. They used to do the candy cane machine, the candy cart, and they would work in medical records, and in HR, we would get volunteers and they would do filing and you get to know them and say, well, what is your interest? So yes, volunteering a medical center like our facility likes to see if you have any community involvement. Okay. For example, the day of caring, were you in a sorority? I'm just saying that. Have you done philanthropy? Did you work with the elderly? Did you volunteer at a nursing home? Did your church go and deliver Christmas presents to a nursing facility? Just anything that shows that you could volunteer versus getting paid, or that you have some kind of health environment. Just having been in that kind of environment, knowing that's patient.
Mm-hmm. No, I think that's great. I love that you expanded it. I constantly are like, hey, I know your time is limited. That's one of the things that I sometimes have students come to me going, oh, I have to get an internship. And I'm like, in the healthcare world, I don't hear as much about internships as I hear about volunteering. So that's why we have an internship page that I highlight volunteering opportunities geared toward the healthcare world, because especially when COVID came along, the state was really trying to get people to volunteer, doing testing and that kind of thing. So what classes do you suggest that students take considering healthcare as their career? I mentioned medical terminology, but are there other classes that you like to see on, because I tell students to include their relevant classes. Are there classes that you like to see on a resume?
Yeah, and again, it depends what focus you're going. Okay. Mm-hmm. You know that. Nursing, anatomy, physiology, calculus, any kind of, math classes, anything like that. Okay, for example, you all had coding. You had coding classes. Okay. To me, when you're in a this facility is so large. Communication style. Even to me, writing. I mean, even any kind of English classes, any kind of, I'm just trying to think. Okay, for example, you have to be able to articulate or say what you want to say to a patient. So any class is going to help you with that. Again, your focus on healthcare, anyone coming into a medical position, you would definitely want, medical terminology. And I'm going to give you an example. Okay. So when I was a pharmacy tech, medical terminology was a must. I mean, I filled prescriptions. I had brand names, generics. I had to learn all the scriptive, BID, TID, all of the frequencies on filling prescriptions for patients. If you're a nurse, you're definitely gonna, I say pharmacology. I'm sure you have pharmacology. And what helped me, and actually, I'll back up a little bit. I was a pharmacy technician, and then I got a job at UVA, and then I started off as a health unit coordinator. And what got me that position back, I don't tell you how old I am, but then we used to write out everything. When I came in, don't say anything. So when I came in, everything was handwritten. So I had already known what the frequencies meant. I already knew the medications. I knew the labs that the patients were getting after OR. So that really helped me become a health unit coordinator. Okay. So within 2 years, I made supervisor. So I was in charge of, and that's another one, supply tech supplies all the supplies to every unit. Okay. I was in charge back then of all the other hucks, traction technicians, scheduling, budget. It's moving up in the organization, moving up. Then again, I ended up being the administrative assistant for one of the division heads. I moved up from there. I did faculty appointments. I processed all the evaluations for the whole hospital. I was the first recruiter in HR for the medical center side. And, we grew and we grew. One time I was the only recruiter, and I recruited for everything: social work, respiratory, labs, radiology, nursing, entry level. And it morphed. I went and got my bachelor's degree, and, and I know everyone on this call today, you have life circumstances. I had a little girl, parents in the hospital, parents in nursing homes, going to school, and work 2 jobs. So if I can do it, anybody can do it. Trust me. And then I went for grad school for about a year. And I had 52 weeks of stats. I had microeconomics to stats, financial management, and then I had a nervous breakdown. No, not really. But anyway, so I took a break. I mean, I'm probably going to go back because I love school. We can never have enough education. But, everyone on this call today have challenges. We had COVID. We lost staff members because the kids were at home. They had to teach their children at home. People lost jobs. But we can stay together as a community. I'm always willing to help anyone if you're willing to put forth a good effort to work hard at that job, because it's not easy.
I think you articulated that so well. That's because that's one of the, how do people handle stress involved in this career field? I mean, one of the questions, some of the classes I often tell students to take geared toward human services, like healthcare is psychology classes. Taking care of others also involves taking care of yourself. So what do you have any suggestions along those realms?
Yeah, I do. I think, connected. For example, our team is very connected. Okay. Now, I don't know other organizations, but we have a FEAP, we have the Employee Assistance Program. These emails come out all the time, stress reduction. I mean, there was something the other day that my boss was showing to everybody, and it was like a diagram, and it showed like title money number one. Okay. And she flipped it around. Title and money were small. Living life was bigger, and controlling what maybe you don't have any control over. So relaxation, I don't know about other like places, but UVA has yoga. We have very, very important. It's the Employee Assistance Program.
Yeah.
It's big. It's big. And it's a great group of counselors. And I mean, how do you, I have a hard time because a lot of my friends are nurses. You see on TV, people coming out of rooms crying, COVID, and I think UVA Health has done a really good job supporting their team. Was it challenging? Is it challenging? Yes. But I think it might be the camaraderie between staff members and getting that support from your management and leadership.
Mhm.
So stress is big. I mean, and some units are saying, okay, it's mandatory that you do 2 shifts in a 6-week schedule. So, that's tough. People get tired, but, I haven't heard a lot of complaining about it, because, well, for example, everybody on this call today, there's a reason why you went into the healthcare field, to take care of patients. It doesn't matter what position you do, it's still going to affect the patient.
Mhm.
And that's why people go into what they do.
Those are great suggestions. I have somebody who asked, can they email you directly? And I'm pretty sure I have
Oh, yes. Oh, yes.
So your email is pst@virginia.edu, right?
Uh-huh.
I'll put that
It's
in
an
the chat.
oldie. It's an oldie, but a goodie.
I was like, yeah, it's funny when you have an alias that it tells that you've been there for a little while.
It's me. I said PST, and they said, well, what other letters? I said, that is it.
I think I
So
still have. I think I still have the gg@virginia.edu,
Yeah.
which I'm like, I haven't been there and I don't even know how many years. I can't believe that somebody else hasn't grabbed that gg@virginia.edu. But so this is, I know we're running out of time, but so that's where you've answered all my questions, but just knowing what you know, and of course, people, if you have, participants, if you have other questions, put them in the chat. I did have somebody who had to head out to go to work, but she thanked you so much. And then, so knowing what you know today, what would you tell yourself to do when you were a student? Like what would you have done differently, or what would you suggest to a student to do, for this particular, for either the healthcare field in general or for getting a job you've already been given so many suggestions that this might be redundant, but if you had other suggestions.
Okay, so I guess what you're asking me what suggestions to do while going to school?
Yeah. So,
well, the pandemic is loosening a little bit. We need to team up with other individuals. We need to get back out there, and we need to start gathering, socially distancing. And I think the biggest thing is that to get with your classmates, get that bond back, because we've all been Zooming for so long.
Yeah.
I think that I'll be honest with you. I mean, continue your education. A couple things that I didn't get a chance to talk about was medical center offers excellent benefits. Your benefits package is considered 38% of your salary. That's comprehensive. That is healthcare, dental, vision, life insurance, retirement, paid time off. In addition, we have tuition reimbursement. If you've been there for consecutively 6 months, you're eligible for tuition reimbursement. And so what I try to tell some individuals is, come in, get your feet wet, learn the policies, learn the procedures, learn the environment, and then start taking classes. But again, I would never deter anybody because, I work closely with K-Tech, and I know a lot of those CNAs are going right into the prereqs as soon as they get out. So I would like to say one thing about working, though. You always have to keep in your mind that this is a 24/7 organization, and not everything is Monday through Friday. There should be evenings, there should be nights, there are weekends. So, that's something that is a challenge right now. Because a lot of people, some people prefer evenings and nights because they're at home homeschooling during the day. But, that's just going to be our life for a while until the kids get back in school. Okay.
No,
Did I answer your question right, Gigi?
Yes, you did a beautiful job. And actually, I had another person say, hey, this is so great and informative that they're hoping it's being recorded and available afterwards.
Oh.
We are posting this on YouTube. It will be on our special events page until the end of the school year, and then it will always be on our YouTube channel. I'll be also sharing this on social media as soon as I get the YouTube link created. And so, yeah, actually, I do actually have one more little question because we have a little bit more. Because I remember once upon a time when I sat in on your first information session that you mentioned about leadership and that how UVA likes to grow people, and you have articulated how you've really grown your career and how you've seen other people grow in your career. But you are like, being confident in your leadership ability, because that's actually, as a healthcare professional, it's like educators. They don't envision themselves as leaders, but you are, because you're leading people to be better through what you're doing to support those people. So do you have any words around that concept of leadership? Because that's some people go, what? I'm a healthcare provider, I'm not a leader. But I know you talked about that once upon a time.
Right, correct. And basically, we can all be leaders, okay? And remember, there's a difference between a leader and a manager. Leaders are, for example, you could come in and be an access associate. You are helpful. You help train new staff. You are a go-to person. Okay, well, in 1 year, we're gonna promote you to a senior access associate. Okay, you gotta be willing to take a risk. And when I say that, I mean that not like risque, but I mean risky. Really, if you want to stand out, like we've been talking through this whole session, if you want to stand out, you're going to be the person that goes beyond and above and beyond. For example, I shouldn't have to tell you every day what to do. You should take the initiative and say, I've got a little downtime right here. What can I do? Not just sit there and, and eat a snack. I mean, basically, leader, a born leader. That's a good question there, Gigi. A good leader may say to their manager, this workflow really isn't efficient. I've thought about this, and maybe if we tried this, our workflow, it may be a little bit, more efficient. Okay. I mean, a transporter and, saying any position that you hold. Okay. As a transporter, you are visible. You are on nursing units. You are in the elevators with doctors and nurses and respiratory. Taking that extra mile to talk to that patient and, tell them, we're going to the OR. This is where you're headed. Health unit coordinator, you're running the nurses station. You got downtime. Wipe the nurses station down, build extra charts. clean the stock room, I mean, take that initiative to say, I can make a difference. I can do more. Don't think of it as a job, think of it as a career. And your foundation of your career starts there and builds. I always told nurses, if you start acute care, I told them, I said, you are building your stepping stones. So you go from acute care, then you go to critical care. So what a takeaway for individuals, think about, okay, here's a perfect question. Where do I want to be in 5 years? Do I want to be that person in the same job? Or do I want to come in and make a difference and move up? I stay in this career because I love what I do. I love working with the community. I love hiring good people. When you build that relationship and it's a good fit for both sides, win-win, then that makes me feel good. I'm going to give you an example. I made an offer this morning. The girl was crying. She was like, this is my dream job. That made my whole day. I know. I was like, oh my gosh, and that's what made my day today. Not only that, but coming here to speak to everyone. So, think of it as, where do I want to start my career and where do I want to, not that there's an ending. There's never an ending, but I'll be here forever, heck. But where do you see yourself? And then I will tell you, if I'm happy to help you, because I have hires that email me all the time, Pam, you were so helpful, is there other avenues I can go, or anything else you think would be good? And so I'm always happy to work with anyone about that. I hired a lot of transporters and greeters who went and got their CNAs. And I encouraged them and I worked with them. And so they work on the nurses units. Then, one of them got hired in psych, which he loves. And they'll go on to nursing school. So, yeah. Mm-hmm.
That's a beautiful way to end this, because that's so inspiring and it's so supportive. And I find that, people need that support, and, because especially when they think they're reaching beyond that cashier position, that I was so glad that person.
Yes.
Question, because I find that that's my thing I see very often at PVCC, is that people limit themselves because they think they're not qualified. And that's where I'm like, grunt jobs are good jobs. That customer service that you learn, that work ethic you learn, that's what you're bringing. It's transferable to other employers. And with UVA being probably the largest employer in town, and ramping up, doing so much entry-level hiring right now, which I is keeping you hopping. But
I love it.
Well, we love it that you love it, because it makes it such a good partnership to help students transition from being students to professionals. So thank you so much. I don't see any other questions in the chat box. So I just want to, I'm going to stop the recording, but let's talk for a second after I stop the recording.
I just want to say one more thing.
Sure.
Being the community liaison, if I am not that recruiter for a position that you are interested in, the appropriate recruiter does get your information. Okay. I do network to work, PVCC. And so I'm the intern person, because I don't want you going here to there, to there, to there. So I'm in contact, and if I'm not that recruiter, I will get it to the specific recruiter for you. Mm-hmm.
Thank you. That is just absolutely beautiful. And I have a couple other thank yous in the chat. So I think you've made a huge impact today. And of course, we'll continue to make that impact because we're recording it. So, but now I'm going to stop the recording. And thank you to everybody who joined us today.
Yes, thank you all so much for taking the time to listen to me. I'm here
Yep.
for you, and keep on taking those classes, and Gigi and I will keep working with you.
Yep, exactly. And so we look forward to helping you grow your career. Thanks.
Yep.
So here's, I'm stopping the recording. Bye.